Welcome to January CME. In this presentation, we're going to talk a little about advanced directives. So we're going to go through some of the objectives that we're going to be discussing. So we're going to discuss the needs for adaptation of determining decisional capacity in our elderly patients. We're going to discuss the differences in living wills and advanced directives. We're going to take a look at DRNOs. We're going to look at MOLS and PULSE. So a MOLS is a medical order for life-sustaining treatment, and a PULSE is a physician's order for life-sustaining treatment. We're also going to discuss the differences between like a healthcare surrogate and a power of attorney. So when determining mental status in the elderly patient, we need to determine a couple different things. Is this their normal? Is this their normal mental capacity? Aging causes changes in mental capacity, and that could cause changes in completing your cognitive test. So make sure you remember your audience. A 95-year-old patient may not understand what an Apple Watch might be when you're using for your example of the 3 items. If you have issues with your decisional capacity, online med control is always there for assistance. And that can all be found in CS12 and your cognitive exam in CT22. When determining mental status, utilize CS12 or refusal of care protocol. CS12 states that we will evaluate all patients to the fullest extent indicated, if possible, and determine if the patient or the third party is the appropriate decision maker. If the patient does not appear to have decisional capacity, proceed with evaluation, treatment, and transport under implied consent. If the patient appears to have decisional capacity, he or she may refuse all or part of the indicated evaluation, which could be treatment, recommended destinations, and/or transport. If the patient's decisional capacity is in question, administer EMS cognitive evaluation to assist in determining capacity. In cases involving third-party consent, ensure that the responsible party has decisional capacity prior to allowing any decisions to be made on behalf of the patient. Document the third party's relationship to the patient. If there is any doubt as to whether the third party is acting in the patient's best interest, i.e. abuse or neglect, immediately involve law enforcement. Documentation for a patient refusing part or all of the evaluation, treatment, and/or transport must include, at a minimum, the benefits of allowing care, the risks of refusing the proposed care, including severe complications or death, the alternatives explained and offered to the patient, and an attempt to ensure the patient is left in a safe location. So what is decisional capacity? Decisional capacity means a patient that can understand their current medical condition as well as the risks, benefits, and alternatives of the proposed treatment plan and has the legal ability to provide consent, i.e. they can't be a minor unless they're emancipated. So let's move on and discuss some of the more common types of advanced directives you may encounter. First, let's talk about power of attorneys. The power of attorney is defined as a legal document that allows the principal or the patient to appoint an agent, which could be a family member, to act on their behalf should they become incapacitated. The agent is expected to place the principal's interest ahead of their own. Some examples of some of the power of attorneys would include financial decisions, the ability to give gifts of money, and to make healthcare decisions up and including ceasing resuscitative efforts. They can also recommend a guardian. If you encounter a POA or a power of attorney situation, ensure the agent has the authorization to make appropriate decisions based on the current situation. Most power of attorneys will have the legal document with them, and if you have any questions, you can always contact Online Med Control for assistance. All right, so we're going to talk about do not resuscitate orders. So per CS15, a do not resuscitate order may apply to a patient with any type of electrocardiogram rhythm, not just those in asystole. The presentation of a valid DRNO does not relieve EMS of the responsibility to provide interventions in a non-arrested patient for comfort care or to alleviate pain. Pain relieving measures may be particularly appropriate in pre-hospital care of such patients. Do not confuse do not resuscitate orders with living wills. Living wills serve a completely different purpose and should not influence the acute application of resuscitation for EMS workers. So let's talk about MOLS and PULSE. So a MOLS is a medical order for life-sustaining treatment, and a PULSE is a physician's order for life-sustaining treatment. These are orders that These are documents are for patients who are both seriously ill and have an expectancy of less than 1 year. Although not yet officially recognized in Florida, if you see one of these, consult Online Med Control for permission to follow patient family wishes. So let's talk about living wills now. Don't confuse these with DRNO, do not resuscitate orders, because these serve a totally different purpose. If you run into a living will, make sure that you contact Online Med Control, but most of the time, living wills are honored by hospital staff versus EMS staff. So now we're going to look at healthcare surrogates. A healthcare surrogate is a person authorized to make medical decisions on your behalf if you become incapacitated. It's a form of a power of attorney, but it's specific to medical decision making. If you encounter a healthcare surrogate situation, assure that the power of attorney has the ability to make healthcare decisions for the patient. If you have any questions, contact Online Med Control for assistance. All right, so in this presentation, we discussed the need to adapt your approach to determining decision capacity in an elderly patient. We discussed some of the differences between DNRNOs, or do not resuscitate orders. We talked a little about medical orders for life-sustaining treatment, and a little bit about physicians' orders for life-sustaining treatment as well. And we also discussed the differences in a healthcare surrogate and what a healthcare surrogate can do and what a power of attorney can do. Thanks for your attention today, and hopefully this will help when treating patients with advanced directives. Have a great day.